Hello, I am Dr. Yogita. I am the founder of Little Lambs Nursery. We have 2 branches, one in Anpur and one in Almada. Every week, I am planning to have a good discussion with you parents about something which is very important in early years. Today, I am going to speak about speech delay. Do you think your child is having speech delay? And how do you come to know? And what are you supposed to do if the child has a speech delay? First of all, do not panic. Do not compare your child with anyone else. It's not a race. You have to give your child its own pace to complete the speech development or the language development. There are certain few things which you have to keep in mind. There are 6 important essential things. Number 1, if you think that the child is late in speaking, how do you know that? Because there are milestones for it. The first milestone is by 12 months your child should be able to start speaking. Not say, but start speaking. By the age of 2 years, until 2 years, the child should be able to blend words and speak in 2 words. After 3 years, the child should be able to make phrases. And after 4 years, the child should be able to make sentences. These are the milestones. Simple milestones. If your child is not started speaking until 12 months, then there is a possibility there is a speech delay. This speech delay could be due to various reasons. Now, the most important things what you need to first rule out is hearing disability. First, find out if your child is hearing when you call him or when something is told to him. How do you know whether he is responding to name, whether he or she is responding to commands, to instructions? That is the first thing to rule out hearing disability. Whether the child is able to understand, follow instructions is also important because this is the receptive language and it is very important. This is the second thing. Thirdly, is there a non-verbal communication which you can see in the child, like waving, shaking hands, nodding the head? These are all non-verbal things which you see in the child. If the child is doing this, it's a good thing, which means the language has to follow. The fourth thing, is there eye contact? When you're calling your child, is the child able to make an eye contact with you? That is also something very important to rule out. Lastly, pretend play. What is pretend play? Pretend play is where the children try to imitate someone. Your child might try to imitate the teacher, might try to imitate you as mama or daddy, or try to call on phone, like imitate to call on phone. If this pretend play is already started, then it's the best thing to see because the language is going to follow. Then you don't need to panic. And lastly, other milestones. Also keep an eye on the other milestones, whether walking, whether teething. All these milestones have been normal. If these milestones are normal, sometimes children speak late and the late comers also speak very well afterwards. So you don't have to worry. The other thing what you may see sometimes, if the children don't have language, there is frustration which comes out and they are not able to express. So they express in different manner, wherein they might pinch you, they might hit you, they might push you to say that they want to say something. So these type of symptoms give you a clue if there is language delay or there is no language delay. So parents, I hope this video is going to help you to understand what speech delay means and what you are supposed to do as a parent. Meet you in the next week. Thank you.